I'm going to do the percussion part, and I'm going to get my hammer out to do it. Okay, and there's 6 spots on the front. So I'm sorry.
You're fine.
5, 6. Okay. Oh, hold on. 1, 2, 3. Hold on. 4. Okay. 5, 6. Okay, and I heard resonance on all those sounds. Can you turn around? Let's see. Thank you. Okay, there's 3 spots on each shoulder. So, okay. Okay, and that was dull. So now I'm gonna do 9 sounds on the back. So. And I heard resonance on all of those areas. Her breathing appears to be effortless within a normal range. I see no signs of barrel chest. Her transverse ratio is 1 to 2. Her respirations are smooth, even. I see no abnormal breathing patterns. Okay, now I'm going to auscultate. So before I auscultate, if I was listening to bronchial sounds, it would be up here. Bronchiovesicular at the inside, and then vesicular on the outer lobes. And posteriorly, can you turn around? Just stand up. Okay. I would listen to the bronchiovesicular up here, and then vesicular on the outer parts. Okay. So now, auscultate with my diaphragm for a whole respiratory cycle, but I'm not going to do that for the video. I would start up here. 2. Oh, let me do 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, and then 6, 6. Her lungs sounded patent and clear. I heard no wheezing, stridor, or any abnormalities. Can you turn around? Okay, and I'm just going to also take the bag, and there are 9 regions here that I'm going to listen to. Okay, so I'm going to go 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. All her lobes were patent and clear. I heard no abnormal sounds. Okay, now I'm going to do the heart. So using my stethoscope, I would first listen to the point of max impulse. So can you lay on your left side? Okay. It is in the 5th intercostal space, so I would palpate and then auscultate with my bell for a full 60 seconds. And I heard nothing abnormal with that. So can you see? Okay. Now I'm going to name the sounds, the regions where I would listen to the different sounds of the heart, and there are 5. So for aortic, it's the 2nd left intercostal space, and I would use my diaphragm for S1, S2, and my bell for murmur. So S1, S2 present, no murmurs. Then the right second intercostal space is the pulmonic. I would use my diaphragm for S1, S2, the bell for murmurs. S1, S2 is present, no murmurs noted. Erb's point, which is the third intercostal space, I would use only the diaphragm for S1, S2, and it's the loudest here. Then I would move down to the fifth intercostal space, and that would be tricuspid, and I would use the diaphragm for S1, S2, bell for murmur. S1, S2 present, no murmurs noted. And then I would go down here to the fifth midclavicular space, and I would do diaphragm, S1, S2, and then bell murmur, and that's the mitral. And then I would auscultate and palpate her apical pulse as well as her radial. And they are equal with regular rhythm and smooth. There's no abnormalities there. Okay, I'm now gonna do the pulses. So I would count the pulses for a full minute each, but I'm not gonna do that for the video. So I would do the brachial, radial, ulnar, femoral, sorry. I would do the popliteal, I would do the dorsalis pedis, and then the posterior tibialis. Yeah. And they're all +2.
Moving on to your cardiovascular assessment. So in order to do that, I'm just going to listen to your heart. And again, when I took her heart rate the first time, she had a normal rhythm. Nothing was wrong with that when I took her vitals. So if you could just take a deep breath in and out for me. First, I'm going to listen to your aortic. Good. And then your mitral. No. Your pulmonic. Good. And your tricuspid. And lastly, your mitral. I'm just going to switch up your shirt. Very good. So her heart sounds are very clear, very normal, no murmurs. And now I'm just going to listen with the bell of my stethoscope. And just listen to the tricuspid and mitral valves. Perfect. So again, that was listening for S3 and S4. No murmurs or nothing was wrong with that. Now I'm just going to be testing your dorsalis pedis pulse and your posterior tibial pulse. So if you could just lay all the way back for me. So first I'm going to test your dorsalis pedis pulse. Awesome. Cool. So they were a 2 out of 3 on both sides, which is very good. And onto her posterior. I'm just going to go on the inside of the ankle here. And just throw the foot. Good. Again, a 2 out of 3, equal on both sides. So that looked really good. Next, I'm just going to move on to your skin. So if you could just sit up for me again. Perfect. So first I'm going to assess the color of your skin. She's clearly Caucasian, so she's fair, pale, which is all very normal finding. Next I'm going to do sensation. So I'm just going to have you close your eyes. I'm just going to poke you on a part of your body. You could just tell me what part of your body that is.
Arm.
Which arm?
Oh, right arm.
There you go.
Left arm. Left leg. Right leg. Tummy. Chest. Neck. Forehead.
Perfect. All right, so sensation was clearly very good. So color and sensation were good. Movement, I'm just going to have you wiggle your toes for me. And roll your ankles. Wiggle your fingers. Roll them out. Your wrists. Perfect. So clearly her movement is also very good. So this is a good finding. And there's no edema. Nothing was wrong. She looks good. Next, I'm going to move on to her pulmonary assessment. So I'm just going to start by saying her respiratory rates were within normal limits. It was a 14, and she's clearly not in any sign of respiratory distress and has no labored breathing or any difficulties with that. So first I'm going to auscultate you anteriorly. So if you could just take deep breaths in and out. So I'm going to start by doing your right apex. Breathe in. Oh, Actually, I'm going to switch back. All right, breathe in. All right, left apex. Good. Left upper. Right upper. Left upper. Right upper. Good. Now I'm just going to do you laterally. So I'm just going to have you face the wall this way. So I'm doing her right side. So I'm just going to have you lift your arm above your head. Perfect. So I'm going to do right upper. Right middle. And right lower. Good. And can you just do the same thing on the other side? Left upper. Left upper. And left lower. Good. Okay, I'm going to do her posteriorly, but before I do that, I'm just going to say that all of her breath sounds were clear to auscultation, and there's no adventitious breath sounds, and it was bilaterally, so she had no problem. They were symmetrical on both sides. So I just want to say that before I do posteriorly. Okay, posteriorly, I'm going to do left upper, right upper, right lower, left lower, right lower, right lower, and then left lower, right lower, and left lower. Good. Again, no clear auscultation, no adventitious breath signs, and this was these findings were by. I'm just going to inspect. Maybe this one. Now I'm just going to auscultate. And then every time I touch, your chest just breathe into your mouth and out through your mouth. Perfect. I'm just going to have you lay back. And I'm going to have you sit up for me, and then lift up one arm for me. Perfect. An arm. Then I'm going to have you turn to your side for me, or the other one. Perfect. You can go ahead and face forward. Now I'm going to locate your apical impulse. You can go ahead and just lay back again.
Your respiratory system, do you have any history of chest infection, any pneumonia, anything like that? Okay.
No.
Do you have any trouble taking breathing?
No.
Okay, so that's good. So looking at her chest, her AP diameter is shorter than the lateral diameter, which is expected. She is not using any accessory muscles during the respiration, no any nasal flaring, so that's good with the respiration. Her rate and rhythm is normal. I'm gonna go back, if we can come over here. I'm gonna go back. I'm gonna look for chest expansion. So go straight a little bit and go ahead and take a deep breath. Okay. So as you can see, my hand moved at least like 2 centimeters apart during the chest expansion, and that is what we should be able to see when she takes a deep breath. Okay. So looking for the doing the tactile parameters, checking for any consolidation. So every time I touch your chest on the back, just go ahead and say 99.
99, 99, 99, 99.
Okay. So I was able to hear the good equal vibration on both sides when she was saying 99. So that means that there's no any consolidation. If she has consolidation, I would hear the unequal vibration of the sound when she was saying 99. Okay. So tactile parameters. I'm going to do the percussion of your lungs. Okay. So going from top. Okay, make sure you get the side of the lungs. Okay, so I was able to hear the good resonance sounds in the lungs, so which is normal if she has the consolidation of the lungs or any air trapped in there. So you would hear either hyperresonance or dull sound, okay, in the lungs. Next is I'm going to check for the costovertebral tenderness, CVA tenderness. That's to check for the kidney. Let me know if you feel any pain or tenderness, okay?
Nope.
Okay.
Nope.
Okay, no any pain or tenderness felt, so CVA is normal. It's normal. Next thing I'm going to do is the auscultation of your lung sounds. Okay, so I want you to take a good, nice breath from in and out from your mouth, okay? So I'm using the diaphragm. Okay, listening in the front for the, so using the ladder technique, I'm doing the same thing on the front. Okay, almost. Okay, good. So I was able to hear the bronchial sound over the clavicle, bronchovascular sound over the trachea, and vesicular sound over the lung tissues, which is normal. Okay, no any adventitious sound, any crackles or rails or anything like that. Okay, next thing I'm gonna do is the egophony test to check again for consolidation. So with that, I want you to say E every time you feel the stethoscope in your back. Okay? Okay.
E, 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 E.
Okay, perfect. So when she was saying E, I was able to hear the good muffled sound of E. If it would change into A, or if the sound was loud and clear, then that would tell us that she has a consolidation in her lungs, like we can see in cases like pneumonia. Okay, so that was normal and good. Respiratory. So moving on to the next system, which is your cardiovascular. I'm just going to ask you again 2 questions. With the cardiovascular, do you have any history of hypertension?
Nope.
Okay. Do you have any history of syncope?
Nope.
No. Okay. And no chest pain?
Nope.
No. Okay. That's good. Okay. Looking at the precordium, just inspecting the precordium. There's no any heaves, striae, or masses, or scars, anything like that in the. Everything is normal, looks normal. I am checking for the costochondritis, just pressing the wall. Any pain?
No.
Okay, so that's negative for the costochondritis. No any pain in the precordium. Palpating for the thrills, okay, with the ball of my hand. Okay, so no any thrills felt when I was palpating, so that's normal. You should not be feeling any thrills in the precordium. Next thing I'm going to palpate is a PMI, which is a point of maximal impulse. It should be on the left 5th intercostal space on the left sternal border, left side 5th intercostal space in the mid-clavicular line, okay? There always should be. So with the females, you just have to make sure that you go lift it up, and breast tissues, and just pull it up. Okay, I'm able to feel it right here, which is good. No any deviation of the lateral movement of the point of maximal impulse, so that's good. If it's on the side, if it's like on the side of the, other than that location, then that would tell us that you have the left ventricular hypertrophy. Okay. Next thing is I'm gonna auscultate your heart sounds for any murmurs or anything like that. First, I'm just auscultating your heart sounds to just hear your normal heart sounds. So the 5 points I'm gonna auscultate is your aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, so aortic is in the second intercostal space on the right side. Pulmonic is the left intercostal space on the second intercostal space on the left side. Erb's is the left intercostal space in the third sternal space, left side. And tricuspid on the left side, fourth intercostal space. And the mitral is the fifth intercostal space, mid-clavicular line. So I'm gonna hear those points for the heart sound, first using the diaphragm. So I'm switching it into the bell of the stethoscope and listening for any murmurs. Okay, so with the bell, I was able to hear the with the diaphragm. Sorry, I was able to hear the heart sounds. S2 is greater than S1 in the aortic and the pulmonic. S1 is equal to S2 in the Erb's point. S1 is greater than S2 in the tricuspid and the mitral valve. So everything is normal. And I did not hear any murmurs or any extra sounds in the 5 points when I was hearing from the bell. So I'm gonna listen for the regurgitations, aortic and the mitral. So for that, I want you to lean forward. I'm using the bell of the stethoscope for the mitral stenosis. So lean forward, take a deep breath, and hold for me. Okay, so for aortic, I'm using the diaphragm. Okay, take a deep, so leaning forward, take a deep breath and let it out and hold for me. I'm just gonna quickly listen to the left sternal border. Okay, and the apex of the heart. Okay, thank you. So I did not hear any regurgitation or anything like that in both sides, on the both points and on the left sternal border, so that's negative.
Deep breath in for me. So chest expansion was equal. There was no, all right, so I'm gonna auscultate your lungs now, so you can just take deep breaths for me every single time I move my stethoscope. All right, so lung sounds were clear throughout all of the lobes. You can sit back now. All right, so now I'm going to inspect your chest. So I'm gonna inspect the chest. The hair distribution on the chest is normal. The skin is dry and intact. The temperature is warm on all extremities, even the arms. And there seems to be no lesions or masses, so I'm gonna palpate the chest. Tell me if you have any pain or tenderness. Any pain, any tenderness? All right, so now I'm going to auscultate your lungs on this side, so just take a deep breath every single time. So lung sounds were clear throughout. There was no signs of crepitus or crackles. I'm now going to listen to your heart sounds, so you can just stay right there. Alright, so S1 and S2 were heard. I did not hear any abnormal heart sounds. And then I'm going to go back up with the bell and then listen at the mitral for 60 seconds. Alright, so with the bell, S1 and S2 were heard, no abnormal heart sounds. When I listened to the mitral valve, I counted 32 beats.
I'm going to inspect your lungs. I'm going to listen to your lungs and to your heart and things like that. So what I'm going to have you to do, I'm just going to have you turn your legs, swing your legs around for me right here. Okay, I'm just going to push this back a little bit. Alright, so now what I'm going to do, I'm just going to get eye level so I can just inspect everything, making sure everything has transverse and things like that. Things is pretty normal. Just go ahead and breathe normal for me. Okay, so now what I'm going to do, I'm just going to palpate your back, and I'm just going to palpate. Doesn't hurt, does it? Good. Just palpating. Alright, so first what I'm going to do now, I am going to just listen to your posterior sounds. I'm just going to listen to your posterior sounds. Just breathe in and out, not too deeply for me. Okay, everything sounds clear to me. The lungs sound normal bilaterally. I don't hear any crackles or anything that should indicate anything abnormal. All right, so now what I'm going to do, I'm just going to have you breathe in and out for me, and I'm just going to put my hands right here. Okay, I just want you to breathe in and out. Okay, perfect. So I just was observing the falling rise. Everything is normal there. All right, so now what I'm going to do, I'm going to do something called tactile fermenters, and I just want you to say 99, okay, for me?
Okay.
99, 99, 99, 99, 99. Perfect. All right, so I'm just going to percuss just a little bit, okay?
Okay.
Okay, so now that I've auscultated, I've listened to your lung sounds back here, and I heard some healthy breath sounds back here as well, because there are some in the back and the front of yours. So now I'm just gonna move to the front. I'm just gonna observe. Just you can swing your legs back this way. And now what I'm gonna do, I'm just going to observe the falling horizon of your chest. Okay, now I'm just gonna listen to the breath sounds back here, up front as well. All right, lift your arm just a little bit. Okay. These sounds equal bilateral. Nothing abnormal out of the ordinary I've heard. All right, so now I'm just going to look at your chest, making sure your chest isn't concave or something. Making sure everything seems pretty normal and things like that. All right, so now what I'm going to do, I'm going to start marking off your heart valves, okay? So the first heart valve, I'm going to start marking off, and I'm on your left side, so I'm going to just start by going with your right. And what I'm going to do, I'm going to go to the second intercostal space. Okay, I'm going to go to the second intercostal space on this side. All right, now I'm going to go to the third one. Is this hurt? Yeah, I'm sorry if it's uncomfortable. I'll start on the one. I'm going to number 4. Okay, I'm just gonna tape it right here because I don't want to touch your breast. You do need your chest. I'm just gonna tape it where let me know if something's uncomfortable, okay?
Okay.
Okay. So now I'm just gonna listen. I'm gonna listen with my diaphragm and my bell. First, I'm gonna listen with my diaphragm, which is to hear it. Then I'm gonna listen with my bell to make sure there's not any dysrhythmias or murmurs or anything like that. All right, and this is, I didn't mark this because I didn't tell you what this was. This was your tricuspid down here. You just do it like this. just a mitral. Okay, so your S2 should sound greater at, should be able to be heard. S2 should be able to be heard greater at the S1 at the aortic one, and then the S1 is just equal on the third intercostal space, and then the S1 was louder at that other valve down here. So now that I've listened to your heart and things like that, I did your lung sounds, I did your breath sounds, I did your heart sounds. Now I'm just gonna look at your pulses and things like that. So I've already done them, your carotid and your temporal, and now you have the brachial and your radial. This is your radial right here. Now I need the brachial. I'm just gonna slide your watch. I'm just gonna slide it up just a little so I can be right here. Alright, then I'm just gonna listen to, just pull your foot up. You have your dorsalis pedis. Posterior vertebra, right here. I'm having a little trouble hearing it. Okay, it was. Sometimes think somebody's alive in there. Okay, I hear that one, feel that one. Okay. I hear them, they're just not downing, but that's okay. It's normal. Everything's a 2+, everything is pretty normal. Okay, so I checked all of those and I already checked your carotid ones and things like that, your pulses. All right, so now that I did your lung sounds and breath, now I'm just going to check your pulsations, things like that.
I'm gonna start by looking at your chest real quick if you don't mind. Awesome. Alright. And then I'm just gonna feel your pulses, okay? Good pulse. Oh, it's pulsing. And then can I ask you to take your arms out for me? Just relax them right there. Awesome. Awesome. Alright, and then can you uncross your legs for me? Can you come a little bit closer to the edge for me? I'm sorry. Awesome. And then could you take your socks off for me? I just gotta feel your pulses down there. Alrighty. Oh, I can feel those. Those feel good. Awesome. Alright. And now I'm just going to listen, okay? Your pulses or your heart sounds awesome.
Thank you.
All right, and now we are going to move on to respiratory. No, we're not. I'm just kidding. We're gonna look at your jugular vein. If I could ask you to lean back for me, please. Oh, right there. That's fine. Hold your weight, okay? And then I'm just gonna take a look. I got it for you. Awesome. And just hold on for a second, okay? Alright. And if you look the other way for me. Awesome. Alrighty. Now we're gonna move on to respiratory. Sorry. You're fine. I'm just gonna look at your breathing for a second. Awesome. I'm just looking to make sure your chest is rising. Alright, and now I'm just gonna palpate. Make sure everything's okay. I'm gonna ask you to take in a deep breath, okay? One more for me, please. Awesome. Okay, and now I'm going to percuss, okay? I can get you these. Awesome. And then when I touch you, can you just say 99 for me?
99, 99, 99, 99, 99.
All right, and then I'm just gonna listen, okay? I'm gonna ask you to breathe through your mouth, and if you start feeling dizziness, just let me know, okay? Awesome. And then we're just gonna do the same thing to the back side. So if you'll just come on that side for me. Come on this side. We're just gonna feel real quick. Make sure there's nothing. And then I'm gonna ask you to take a deep breath for me. Awesome. One more. Awesome. And then I'm just gonna percuss. Alright, and then when I touch you, can you just say 99 for me?
99, 99, 99, 99, 99.
Alright. And then just breathe in through your mouth one more time for me.
And okay.
So from here, I'm gonna assess your respiratory system, okay? Have you had any difficulties breathing, anything at all?
Nope.
Okay. So upon assessment of her skin is clean and dry, checking the temperature, and she's warm. And now I'm going to auscultate for lung sounds. Okay. Nice deep breath. Excellent, lungs are clear. And now I'm going to percuss your chest. I want to ensure that I hear resonance, okay? All right, resonance is heard, and that's within normal limits. I'm gonna go ahead and assess your respiratory on the back.
All right.
Okay. All right, nice deep breaths. One more. And again. And again. And one more deep breath. Excellent. Lung sounds are clear, no adventitious lung sounds noted. Now I'm also going to percuss her posterior thoracic. Okay. Excellent. Excellent. All right, Carissa. I'm going to check for tactile fremitus. I need you to say the words 99.
99,
One again,
99,
and one more.
99.
Excellent. Tactile fremitus is higher and becomes lower as I move my hands down. I'm going to check for thoracic expansion. Okay, so I'm at the 10th intercostal area, and I want to make sure that my fingers expand 1 to 2 inches. Take a deep breath in. Okay, so my fingers expanded about 1 inch. So her tactile fremitus and her thoracic expansion are within normal limits. And upon inspection of her back, her skin was clear, dry, and warm. No evidence of any masses, abrasions, or abnormal lesions. Okay, so Chris, any pain at all? Excellent. All right. I'm now going to assess your cardiac system. Okay, so if you could lay back on the bed. Okay. I'm going to listen to your heart. Okay. And first, I'm going to let you know what parts of your heart I'm going to listen to.
Okay.
Okay. So at the second intercostal space on the right sternal border is her apical pulse. Second intercostal space on the left sternal border, aortic. Second intercostal space is her pulmonary. The third intercostal space is Erb's point. And her fifth intercostal space would be her tricuspid. And at the mid-clavicular line, I would find her apical pulse, or mitral, also known as the point of maximal impulse. So now I'm going to listen. First, I'm going to listen with the diaphragm, and then I'll listen with the bell. Okay? And just breathe normally as you normally would.
Well, one of them doesn't have. She put the one in the middle. Oh, okay. Yeah. The rest I just wondering, yeah, because I saw the stickers over here. Oh, okay, yeah. Because I'm like, there's
Sorry, I'm going to move your bra.
It's okay.
Excellent, very strong. Okay, heart sounds are strong and regular. Now I'm going to listen with the bell. And I'm listening for any bruits. Okay? So I'm going to lift your bra again.
Okay.
Excellent.
Hi, my name is Amanda. I'm
And,
your nurse
sorry.
today. I saw that your call light went off and you're having some trouble breathing.
Okay.
I'm gonna
Third
start by
intercostal
raising
space.
your head of the bed.
At Erb's point, back up to pulmonic,
And I'm just going to start off with a little respiratory assessment.
and back at
So
the
I'm
aortic.
checking to see if the patient, if you have any labored breathing, your chest is rising.
Okay.
looking for needs
So no
of
signs of
air,
bruise.
feel
Heart
tugging,
sounds
use of your accessory
are strong.
muscles. And I would also
Okay,
suggest
so I have
posterior
inspected and I have
thoracic
auscultated
I'm just
her
gonna-
heart
copy.
sounds. And okay, so now we're going to check your capillary refill of your hand and your feet.
I'm sorry.
All right.
Okay.
All right, capillary refill is back within less than 3 seconds. And I'm just going to check one of your feet. Your feet are really cold.
Yeah, which are?
All right, capillary refill is returns
get that.
within less than 30 seconds. Okay. And sorry, just need a second. All right, now we're gonna go ahead and I'm gonna do your pulses. Okay, so I'm gonna start at your temporal, move down to your brachial, radial, dorsalis pedis, and your posterior tibialis. Okay, I wanna make sure that your pulses are strong, equal bilaterally. All right. And right after this, I'm gonna do your carotid, okay?
Hi, my name is Amanda. I'll be your nurse today. Can I just have your name and date of birth, please?
All right.
So I saw that the call light went off. You're having some trouble catching your breath. I'm just gonna start by raising the head of the bed.
All right, Carissa, so
And
your
I'm just gonna
pulses
do a
are
quick
strong,
respiratory assessment.
equal bilaterally.
Um,
Now let me go ahead and I'm gonna auscultate your carotid. I just need you to hold your breath, okay? For a couple seconds. Make sure I listen to it with my bell. I'm listening for any bruise.
A use of accessory
Alright.
muscles, and I would also then inspect the posterior thorax. And next I'm just gonna palpate the front of your chest, just for any bumps or abnormalities.
Okay. And while I was
And I would also
listening
palpate
to
the
your
posterior
carotid,
thorax.
I saw that you had moved your
And
neck,
I'm just gonna listen
and I
to
don't
your lungs.
see
I'm
any
just gonna
jugular
go down here, count.
distension.
On you is basically I'm just going to be feeling around and just listening to your lungs, and I'm just going to do a couple things. So does that sound okay with you?
Yep.
Okay, perfect. So do you have a history of asthma?
No.
Okay. Have you ever smoked?
No.
Okay. Good, good. Patient is upright, symmetrical, and pleasant. So First, I'm just going to start by inspecting the patient's anterior, posterior, and lateral chest. Okay, perfect. Patient has a ratio of 1 to 2. Next, I'm just going to inspect her color. Patient has a light skin tone and effortless breathing. And now I'm just going to feel her posterior chest. Patient is warm, dry, has no masses. Do you feel any pain?
Nope.
And no tenderness. Okay, next I'm just going to ask you to turn around. I'm just going to feel your back and ask you to breathe in and out for me. Just breathe in and out. Perfect. Patient's chest expanded while breathing in and out. Last but not least, I'm just going to listen to your lungs. Does that sound okay with you?
Yep.
Okay, perfect. Okay. Just breathe through your mouth. Sorry. Now move to your sides. Smell on something's written. Sorry, just gonna. Now, if you could just turn for me and I'll listen for your back. Okay. Everything sounds great. Everything sounds great, and I hope you have a wonderful day. Wash my hands. Stop.